Okay, so this is my abnormal psychology and treatment project. The character I will be reviewing will be Gregory House from the TV show House. The setting is in Princeton Plainsboro Teaching Hospital in Princeton, New Jersey. This is a fictional hospital, but the character synopsis is that Gregory House is a medical genius compared to someone such as Sherlock Holmes. He plays mind games with his friends and colleagues and suffers from a severe pain, which he treats with Vicodin. His symptoms are extreme narcissism. He has a huge ego and self-regards while self-loathes. He thinks of himself as better than everyone else, and because of his trust issues, lives in a world that surrounds himself. He is self-destructive in a way, and he has the need for simulation. So he wants to feel things even though he can't. So he turns to medical cases, which get his mind off things, as well as puzzles. So you'll always see him in his office doing puzzles. And every chance he gets, he pops a Vicodin. The way he messes with his coworkers and talks down to them shows the kind of egotistical way that he has about him. The need for simulation is also a symptom of sociopath. So, just as I said, the disorder that I will be talking about is sociopath or sociopathic tendencies. In season 3 of the show, House says that Vicodin his intake is because of pills make him normal and allow him to do his job properly. So without the pills, he doesn't feel like he can function. So he has become deceptive in a way to those kinds of things. And in season 5, House displays regression through his immature behavior. He only does what interests him, and he hides from all of his emotions. And in season 7, he loses a friend due to his attitude, and he displays acts of immaturity, such as driving a Segway through the hospital, and he has really rough relationships with women. And in season 8, he does everything he can to avoid the stabbing of one of the hospital members, Chase, and starts focusing on cases while pranking other hospital staff and making them feel lower than they are. So this is my video on progression. And the reason that House is the way that he is because he grew up with an overprotective mother and abusive father. So whenever his father would be home, he would get emotionally abused and even physically abused. But whenever his father would leave home, his mother would take over the role and hover over him, and that would make him resent both of his parents, but his father even more so, because in the show he does things that kind of goes against everything that his father did, because his father was an organized and neat person and House is very disorganized. His sense of security diminishes, which it causes his lack of trust issues. As you can see in the picture, it says, "You can trust me." And House says, "I can't trust you." And he thinks that everyone is lies and they don't tell the truth. But during all of this, House is a very pathological liar, and so it kind of offsets his position and way of thinking. He is very self-destructive, going back to his like Vicodin addiction. Even though he tries to help people with medical cases, he doesn't know how to help himself. 1 in every 100 people are sociopath or have sociopathic tendencies, and this is worldwide, not just in America. But in today's society, especially here in America, there are more people with sociopathic tendencies compared to decades ago. And this is because of social surroundings and because of these norms that are happening. Because if someone they think they can diagnose themselves and have some kind of mental illness, it's the cool thing to do. And the quote on the picture that I have beside it is, "The concept you have about me won't change who I am, but it can change my concept about you." And this shows some of House's good tendencies, because the way that someone thinks about him, he doesn't really care about, but at the same time, it shows the way that he is just very self-absorbed and doesn't really have feelings. So there's my works cited for that, and we're going to go into treatment. So the way I think that House should be treated is through psychotherapy. And psychotherapy is talk therapy, and it can help people with antisocial personality disorders, which is also sociopath disorder. And through that, he can seek anger management, which he needs because he has frustration tendencies, substance abuse treatment, which can go back to Vicodin, and his tendencies to fit the person, such as things to help him stop being rude and actually care about other people that are surrounding him, such as his friends. So Sigmund Freud created psychotherapy in the early 1900s, and to the right you can see a picture of Sigmund Freud. During this time, it was before World War II, but after World War II, they used psychotherapy a lot more with patients and soldiers that had PTSD. And from there, it is still used today with anyone who is struggling with depression, usually, but it can be treated to help with any kind of psychological disorder. Course of treatment, it can last however long a patient desires it to last, but it depends on the therapist's analysis of whether they needed more sessions or not. So, for example, a patient can stay there like 1 session or 2 sessions, but nowadays that really has to depend with money, but insurance can help with that. In some cases, it can last a few weeks, and in other cases, it can last up to years or even a lifetime because of how much they're damaged. And here's my video concerning treatment and my works cited. So I hope you enjoyed this and you learned a little bit about Gregory House.